was Prof. Takalani and Ms. Renee Sparks, and also Dr. Laetitia, who are here sitting with us. I think to kickstart this particular process, I would like to give a brief intro of Dr. Sean McPatrick, who is going to be giving our keynote speech to try and set the tone for this particular session. So Dr. Sean Patrick is actually a senior lecturer at the School of Health Systems and Public Health at the University of Pretoria. He's a scientist in the Environmental, Chemical Pollution and Health Research Unit, and also Management Committee member at the University of Pretoria in the Institute for Sustainable Malaria Control. And he was also an executive member of the Center of Environmental Justice in Africa at the Faculty of Law in the University of Pretoria. Currently, Dr. Patrick, his focus research area is around endocrine disruptors, since transdisciplinary approaches are required to deal with complex environmental social issues that have been influence on existing emerging diseases. His work focuses primarily on sustainable development goal number 3, and also goal number 4 and 6. His research has been published in high impact journal, 6 of which have an impact factor of 10 and 2 of which are at 15, and 1 on Nature publication with an impact factor of 69.5. His work has been mentioned in 272 social media posts and also 22 newspaper articles and quite a number of policy documents. Dr. Patrick also holds a position of Secretary of the Public Health Association of South Africa, PHASA, and also Vice Chairperson of the Association of Schools of Public Health in Africa, and also and the Global Network of Academic Public Health Faculty Development Subgroup member. He is also involved in several water research commission, Medical Research Council, National Research Foundation, National Institute of Health, USA, Canadian Health Institute Research, USA Department of Defense funded research projects with a special interest in emerging contaminants in water, endocrine disrupting chemicals, reproductive health, toxicology, environmental health, and community resilience. I think that's a world of experience that we are bringing through to this particular session that we have sitting here with us in this session, where Dr. Patrick will be doing a keynote speech to open this particular session. Dr. Patrick, kindly unmute and share your screen, and you're welcome to give us your keynote. Hopefully you won't have any technical glitches or any technical challenges. Colleagues, Dr. Patrick, you are welcome. Please do share your screen. Thank you.
Thank you very, very much for the very kind introduction. While you were talking, I was just realizing, you are speaking of so many things, and I think it's quite relevant to what we're talking about this morning about training a workforce. And I think when I reflected when you were busy talking about all these committees and all these things, these are really things that would occur over time. And I think being fortunate enough to have mentors, but also allowing you to go to these training courses, to go to to attend workshops and present. That is really what is key when we're talking about training the workforce. We need to create these opportunities too. And if I reflect on the week, some of the discussions that I've been involved in, one in particular with the young students, for example, it was really something that they had mentioned. What are these skills that they need? And if they have desire to have a skill, how do they then?
Habari ya hali ya hewa huko? Baridi.
Prof, Prof Francis, please unmute. Please mute.
Uko wapi?
Okay. What is the process that they need to go through, and what are some of these skills? So what I'll do, there we go. Okay, so for the purpose of this talk, I'll take you through a bit in introduction of, in my opinion, what's the healthcare workforce. We'll talk a little bit about the public health workforce roadmap, some of the work that has been done, which will preface the presentation, and then talking about what are some of these skills that, in my opinion, we need to cultivate in order to have this future healthcare workforce. And then I'll share some of the examples where I have been involved in particular in some of the research we've been doing and developing of the curriculum, because we also realize that it's not sufficient enough to say we need these skills, but they are not incorporated into the curriculum when we are training our public health professionals, whether it's at the level of the diploma or whether it's the level of a master's, for example. So where do we actually incorporate these changes, and what do we do so that we make sure that our public health workforce can be resistant to any change as far as the future is concerned? So if you look at the WHO definition, they've identified, or they've defined a health workforce as all persons engaged in actions whose primary intent is to enhance health. So it is quite broad. But for us as academics, especially speaking about myself, it's important to make sure that we offer all of these skills to all of these potential professionals in order to ensure that they can that they are able to engage in all of these activities. So what we really need to bear in mind is that the health landscape is it's evolving, and because it is evolving rapidly, we also need to make sure that we enable enough resources, number one, excuse me, but also skills that we can train the next generation. And what is really important, excuse me, and what is sometimes lacking in the training programs that we have is being able to do majority of the things in a digital or online environment, and also to understand the wealth of data that is being collected. In the past 2 years, we've seen a great rise in using technology, for example. But it's well and good to say, yes, we're moving towards technology, but do we actually bring that into the public health programs that we have in order to enable a student to understand how the collection of data works, how the data, to interpret the data, especially these large data sets, in order to be able to understand that most of the we need to combine the disciplines, so transdisciplinary research, for example. And if I don't understand how that works, how can I interpret the data in order to make a change, or in order for my own professional development? So when you look at building a future workforce, there are a couple of things that are involved. So I thought of, when I was thinking of putting this together, I thought, what are some of these things that we need to do within an evolving landscape, whether it's technology? We need to take into account the disease patterns are starting to change. We know there's an emerging need to have access to all services, but there is really a few other things that we need to bear in mind in order to move forward. So there is a paper actually out last year that reflects on a conceptual approach to building the capacity of the public health workforce. It is based on a WHO report, but what I really like what the paper talked about is we need to think of building capacity, but we need to think of building capacity in a structured way. It doesn't help to increase the numbers of graduates, but the graduates aren't competent enough to handle the issues we are dealing with. But also the issues are changing due to various reasons, and we really need to define what are these functions and services that we need. So there are some essential public health functions, and we really saw that before the pandemic, We used to have there's a detailed list, but when we moved into the pandemic phase, we realized that there is a limitation in some of these issues. So we need to change the focus slightly into seeing what are these competency-based education or competency-based curriculum that we can have in order to capacitate the newer group of students we have in order to become these public health professionals, and then to map those against occupations. Because now we're realizing that we need people in different spaces, but if that person is not equipped to handle the changing environment, they often struggle. But that is an ideal opportunity to then create collaboration and create teams, teams again. But how do we go about doing that? So it's this constant back and forth and needing to have this roadmap in order to ensure that this is possible. So if we're looking at the essential public health functions, for example, and trying to incorporate this into a competency framework, for example, there are really three distinct areas that we need to be looking at to define what are these functions and services that we actually need, what we need right now, what we need in the future, for example, and how do we train? How do we train? How do we adjust the curriculum or introduce a new curriculum, for example, in order to be able to offer these functions and these services in a changing world, and to map and to measure those to see what we are doing. Is it really effective? Yes or no? In order to be able to have an ideal system. So if you think of operationalizing this roadmap, what is quite good and what has worked in other countries in various forms is really to benchmark and see what are some of the issues that have worked, and if they have worked, how can we implement those, or how can those be tailored for this African context, for example, or the African context in that matter. So that the WHO framework talks about a progression matrix in how a country can see what is available on different levels. Is it on a national level, for example, where certain things can be done, where there's support, where there's resources, or whether it's more on an institutional level, where the training needs to support some of these initiatives we have on a national level. This becomes quite important because you cannot implement a plan, implement a policy without having the workforce. But you also cannot expect a workforce that is not adequately trained to implement the strategies you have in place already. You're setting up everyone for failure. So there needs to be constant monitoring evaluation in order to ensure what we said we're going to do, have it capacitated, and can we actually measure the progress. And if you dig a bit deeper into the WHO framework and what they are saying, is really that it's this: we need to we need to do more integration of the national planning and making of policies, for example. You cannot make a policy without consultation, but are you having the right people in the room when you're making these policies? It's difficult when you're faced with a policy. When you're reading it, you can see, but there is no way this can actually be operationalized because there are certain support structures that are not there. By strengthening certain support structures, by having key stakeholders or partners, for example, may allow that to actually progress. So when I was preparing for this, I thought, if we are saying we need all of these skills, and we talk about, and the roadmap talks about how do we, change the curriculum, or how do we change the way that we train? What are some of these things that I think would be important for the next generation? We're training this new healthcare workforce, and I try to sort of incorporate them into themes to make the discussion easier, especially for the panel discussion we have later. So around curriculum development, there is a great need to have local examples. There is a great need to have a curriculum that is that incorporates the competencies that we need. But also there is an opportunity for interprofessional education and to foster collaboration. We know that some of the issues we are facing right now, it's not the first time we're facing them. You'll still have pandemics in the future, for example. So what have we learned from the past, from different disciplines that we can incorporate? And I'll share an example of that. Because we're now in a world where everything is available, it's digital, it's technology, how do we use some of these tools? And I have simulation-based learning, for example. But with all the tools we currently have now, it's easy to look at pandemic preparedness, for example. You can play out disaster risk management scenarios, for example. It can be online as a preparation tool. We have the ability to do all of that. And I think it's also for public health professionals to realize that it will be continuing education. As times change, we also need to provide skills and knowledge, for example, but not just for the emerging professionals, also for the established professionals. Because even if you are established in your field, new things do come about. And if there is an opportunity for faculty development, you end up having this younger workforce being trained, but your experts in the field, they do not, they're not they don't have the skills, but they may benefit from also having development for themselves. And quite a big thing, and as our chair was talking about, all these things that I've been involved in, that is really because I had mentors at certain stages that would invite you to sit into that meeting, the working group, for example. And it was merely there for you to observe. So when you are in that position 5 years later or so, you can understand why some of these decisions and discussions were being made. So when we're thinking of a few things, so I'll share a bit of the work that we have done, and I think I'll start with research because in this new, the world is changing. There's the technological advances. There's a big issue around using artificial intelligence, data science, for example. So what we did is we actually asked postgraduate diploma public health students. These are students coming from all over different backgrounds that were interested in studying public health, to ask them what is their perception of artificial intelligence. Do they think it has a place in healthcare? Do they think that it is a competency that they need to learn in order to be able to navigate any of the issues we may be having in future, for example? And of the, we interviewed 900, or had response from about 900 students. And what they do is that they say that while some of them feel that artificial intelligence is beneficial, there were but concerns that we're now training a workforce, but yet you're bringing in tools where things can be done automatically. So how do we ensure that we don't replace some of the essential jobs with technology, for example? Some issues that were raised. There were issues around education, feeling that it should actually be incorporated into the curriculum, for example. Could I please ask, what the recommendation from the students were is that they were then suggesting that we need to look at further studies and also artificial intelligence incorporated into the curriculum itself. Could I please ask one of those participants just to mute themselves, please?
Ngiyakuthatha kade ndinibizwe ka-features of it. Like embassy ke what is this? International trip. What are they?
Yourself,
Colleagues,
please mute yourself. Moleko, please mute.
Okay, thank you very much, Chair. So looking at one of the suggestions was if we are asking their opinion, and one of the comments really was we need to incorporate this into the curriculum, that we can start talking more about it as we're training. So what I ended up doing is taking that into consideration and developed a new course called Data Science for Public Health. And what I tried to do is try and incorporate some of the issues we're talking about and in training the next generation, and thinking around themes around data management tools, what we currently have, newer tools, technologies around analysis of the data, for example. So not just the basic concepts of epi and biostats, but some of the other detailed data analysis techniques. We talk about big data and machine learning, for example, as far as public health is concerned. What is the visualization of this data, different ways of doing it? What is this application in public health for evidence-based, evidence-informed public health, value-based health systems? And one slide at the bottom is one of the sessions that we have is around the data in health that we have, right? So what is the politics, economics of healthcare, different types, groupers, and as far as case mix is concerned, looking at regional comparative measurements, clinical outcomes, pricing, etc. In order to start to train a next generation that is well equipped to deal with some of these issues that we have as far as large data is concerned, but really to tailor that in order to be applicable to public health. And then as far as the training aspect is concerned, as I'm now putting my hat on as from the University of Pretoria, so I coordinate the Masters of Public Health program there. What's essential for us really is to ensure that students that are in this program would have as many opportunities to be able to gain these skills that will not only be useful currently, but also be useful in the future, for example. So in order to reach a wider group of potential public health professionals, our postgraduate diploma was taken online. And we started in May 2020, which was quite fortuitous just as the COVID pandemic was starting. And since then, we've enrolled about 2,500 students and graduated about 1,000. So in order to train the next generation, we are trying to put all of these training opportunities in place. The Master of Public Health currently is offered face-to-face, and there's about 850 students since 2000 that have graduated. And there's quite a need, if we're thinking of changing the way we're doing things, we need to monitor and evaluate how it's working. Otherwise, we're just doing it for the sake of doing it. So what I'm developing currently is a new Master of Public Health fully online in monitoring evaluation, and we hope to launch that next year to reach or rather to train a next generation that can also be able to monitor and evaluate these changes that we are saying we are going to make, which is quite important. So in 2020, when this was launched and during the pandemic, one of the things that we really said we were really trying to do is to not just have a course online for the sake of having it online. It must engage the student, and it must keep them motivated and choosing the topics that will promote a deep learning in order to be able to address these issues. And what's nice about the program, it is adaptive, that we can have these live sessions. We do have these speakers that would engage the students in some of these topics that we have that are quite current. Because we know that the Master of Public Health is a flagship degree of the Schools of Public Health, we launched a multi-institutional study in South Africa, looking at the competencies of these graduates. And the questions, there were two questions. One, what do the students think are the competencies as they have achieved from the program? So we spoke to graduates to try and understand, do they think they actually obtained what they said they were going to obtain? And when they were in the workplace, how relevant were these competencies to the workplace? And there were quite a number of responses. From those responses, the one was around having more background on data science, data and analytics. So in response to that, we created the module, for example. Another one was that although the courses are quite broad in disease control and environmental health, but there is really nothing about program management. It's what is lacking. It may be one course in a particular program, but there is no real focus on this monitoring aspect. And the response to that was then to create a entire degree that is focused around that in order to be able to train. And this really feeds into a larger discussion around the Association of Schools of Public Health on the continent, where we are trying to, and this is one of the roles that I have, trying to formulate what are these core competencies for the African continent. It's not an easy task by no means. There are a number of PhD students that are involved. So it'll be an ongoing discussion in order to make sure that the next generation workforce is adequately equipped. But on a global scale, we also realize that as far as the faculty is concerned, they also need some support too. So I'm on the faculty development working group for the Global Network of Academic Public Health. And what's really essential is that, while currently the focus now is on pandemic preparedness and response, which is true, but that feeds into a much larger conversation. We need to build a competent workforce, both with younger, inexperienced researchers that can see the gaps, but also experienced researchers that are now able to unpack and to understand what these complex these issues are. So if we're going to train for these essential public health functions, how do we also strengthen the faculty that teaches these? Because I can't expect the student to learn these things if the coordinator of the program or the lecturer is also not capacitated in order to do all of that. And through this network, we're trying to map and measure the occupations and how they actually contribute to global health. And again, it's a part of a network. So as part of the Association of Schools of Public Health in Africa, we are a member of this global network, and through this network, trying to reach out to all our partners as much as we can in order to ensure that we do this forward. So when I was preparing for this, I reflected on a paper that we wrote during the pandemic, thinking about the lessons that we've learned, and not focusing on the pandemic, but what we've learned through there. And it highlighted the gaps we have. It highlighted the lack in some of the competencies and skills that we have, both in our emerging and our professional researchers. And when I was reflecting on this, I sort of thought of a couple of things. And some of these really is to integrate the approaches we are using. We realize that now is an opportunity, as we are training, we can also use some of the new technologies that are available. In a very, very short space of time, we were able to make great advances in whether it's a screening application, for example, or a new technique, or refining a technique, for example. So in here lies an opportunity to be able to do that. One thing that we really do need to place more emphasis on is engaging the communities, but not only at the end when the research is done. So when we were writing that paper in particular, I wrote a section on that if we're saying we are incorporating community members in our work, that actually needs to happen. They need to be what we termed as a thought partner. So a thought partner in the planning of the research, because when a thought partner is involved in the planning, they are more likely to be involved in the collecting as well as implementation and taking responsibility for certain actions later on. If you involve a partner at the end, when everything is done, you find that the implementation, you struggle with implementation because there is no buy-in, and the implementation does not speak to the needs of the community in the first place. So if we're thinking of human resources development, if we have identified all of these issues in the beginning, it makes it easier to have these strategized dissemination activities where you're sharing this knowledge. And from the COVID-19 pandemic, for example, we have learned quite a number of insights in how to strengthen the health system in its totality. So what I'm almost at the end, and when I was thinking, how do we then map these? What is an easy way of doing it? And really, for me, this presentation really is at the end. It's a call to say, how do we do this? And what is the road that we need to take to get there? And it's really around these ensuring that this future-proof the public health workforce. We need to define what is important. So what are these competencies? But that does require these partnerships. and it has worked in certain instances or in different levels. How can we learn from that, both locally and internationally, in order to be able to operationalize these competencies? It doesn't help saying we are teaching it, but there's no way of implementing that. And we need to tailor the training opportunities we have. If we're doing that, we will then strengthen our workforce with the skills we need. By doing that, we will identify the challenges and the barriers that we have, but also come up with solutions, because now it is a multifaceted approach to changing these solutions. And that will really enable us to have this future strategies and this, what I call it, a roadmap. But it's, well, what are these plans, these policies, these stakeholder engagements that we keep on saying we're going to do, but are we having the right people in the room at the right time? We often like to have these big working groups, but if you really look at who does what, you realize that in actual fact, it's the wrong people that I'm talking to. I need to have a different group of people for this discussion. And really then we will then get into a call for action. So on the next couple of slides, I unpacked each one of these, but really this one for me is for me the most important, in that if we're looking for essential competencies, we need to train a workforce that is able to understand the digital tools that we have. Some of them are very complicated, but we need to be able to understand where we are moving towards: electronic health records, big data analysis, for example, and not be afraid to have this interdisciplinary collaboration. On some of my projects, for example, there's an architect and an engineer involved, simply because they bring a different perspective to what I am doing. And when we're approaching things, their thought process changes quite dramatically, and therefore it makes our question is robust enough in able to be to answer that, and also to be able to make sure that we can adapt to the health threats, changing technologies as far and as global health is concerned. Enhance the training models and integrating the skills. We've tried doing that on a small scale. In some of the modules, we have recirculated newer modules that we have introduced and what we are still planning in order to ensure we have all of these competencies. And then we need to have a means of a progression, the matrix: benchmark, implement, monitor, and evaluate, to see where are we 5 years from now. If we have the same conversation 5 years from now, the conversation should not be what are the competencies that we would like this workforce to have. The discussion should rather be, we've identified a number of competencies. How far have we gone in training? How far have we gone in supporting? How far have we gone in implementing some of these? And what are the new set of competencies, or maybe the new set of opportunities that we need to have? And then last, as far as collaboration is concerned, there is collaboration in various forms. All of us are part of different academia, health services, global networks, for example. But one panel discussion we had earlier in the week was, do some of these global networks talk to one another, and do they make an allowance for the younger generation to actually become involved? Some of these networks do have a junior wing, but not all of them do. So what opportunities are we in some of these global network associations creating for the younger generation to also come in, have a session, and have their voices heard? And then by doing this, we'll identify the challenges, the barriers, identifying the gaps, addressing the inequities that we currently have. We know there's a social determinant, the gradient that we have. We know that there is the access to our healthcare is not the same for everyone, and we need to start addressing those. I think this is my second last slide. And then it's important to have these long-term goals. That's why we are here. Talk about what can be done in the short term, but most strategies are 5 years long. So if it's a 5-year strategic plan, how are we focused enough to make sure we are achieving that? So when we involve our stakeholders, we can say, in these 5 years, this is what we aim to achieve. How can you support us in doing that? And sometimes it is by taking up these professionals that we have created. and then a commitment to continuous improvement, and last but not least, engagement and to advocate for some of these policies. Because the policies do exist, but to implement them is often a problem. And now, how do we go about doing that? So just in the end, I'd like to thank the organizing committee, as well as PHASA for the opportunity. And also, maybe if you allow me, Chair, just to thank everyone for the week. I think it's been quite interesting, and leading up to discussions, we're talking about changing the barriers and everything, but it really comes down to this new workforce that we are training. So for some of the activities that we do, and as far as PHASA is concerned, we try in addressing some of the issues that we do have, and we do have some of this information and activities that we have on our website. And if anyone that wants to be a member, I'm using my hat as the secretary of PHASA. If you would like to become a member, please do. So we would like to hear your voice. So when we do have these discussions in next year, for example, we can bring in some of these issues. Thank you very much, Chair, for the opportunity.
Okay, thanks a lot. Thanks a lot for such a insightful and thought-provoking presentation. I think there's a wealth of information that comes from what Dr. Sean has just presented on, where he's clearly articulating most of the stuff that he touched on around building a future workforce. And also the evolving space. And I must also acknowledge and appreciate your presentation, your design and layout of the slides, and how easy it is to follow. And of course, assimilate the information that you are that you are putting across. You have spoken a lot around a continuous quality improvement, the application of M&E, and you kept on hitting on that so as to drive the message home. And I think one of the key and critical things that you spoke to, it's around community involvement, not only at the stage of implementation, but from conceptualization phase, the design of the programs, the design of the work that we would want to do, and the actual planning, and the implementation, and of course the redesign phase of the work that needs to be done. Colleagues, on that note, I would like to open this up to our panel members to come through with their thoughts around the presentation, but also to touch on various aspects that I'm going to be posing. I'm going to be posing a couple of questions to our panelists. Let me start off by Dr. Laetitia. Possibly you can share your thoughts around the presentation. But one other aspect that I want you to touch on is that from your perspective, which are the specific rights competencies do you believe are the most crucial for the sustainability and effectiveness of our health systems? For our health systems to be effective and sustainable, what do you think are the most crucial aspects? Please reflect on the presentation, but also touch on this particular question that I'm posing to you. Over to you, Dr. Laetitia. Please kindly unmute. Thank you.
Okay, thanks so much. I really appreciated the presentation, Sean. It was, if I could just say upfront that you basically outlined an entire important process for us of, what is required from stakeholder perspective and how we interrogate what are the competencies and rights in terms of building a successful health system. And so it's, it comes to, I think it ties in with me answering the question as well, because I think Sean has outlined everything so well. I'm not going to go into great depth of that, but to say that it shows us how, we need to start again, and it speaks to what we have alluded the entire week, starting off with, speaking to communities and engaging them at the very beginning of these conversations of addressing competencies, and not when these things are already at an implementation phase. And so, part of it, as I said, to answer the question would be that if we want to look at sustainability and effectiveness of these health systems and, in terms of a multifaceted approach, the key competencies that I would suggest would be, and Sean has alluded to this, would be the health information technology. Competencies around that is very important in terms of quality of care, patient outcomes. Also with data analytics, electronic health records, we know that health records at the facility level, there's been a lot of challenges at that space. So, having a system in place to deal with these health record management, it would be very important. Also including telemedicine and cybersecurity as well to safeguard patient information. We know that we've had several global glitches over the last few months that have affected, online security systems. And so we need to safeguard those patient information systems as well. And of course, it comes with part of managing records that we tap into the sphere as well. Another would be the interdisciplinary collaboration. I think competencies here are very important, especially around, the various healthcare professionals, because they range from, I'm just speaking, going past a student into, when they are at the workforce, we're talking about physicians, we are talking about nurses, pharmacists, public health experts, administrators as well. So competencies in interdisciplinary teamwork, communication, cultural sensitivity, are needed for coordinated care delivery, I would say. Another one that I can touch on, I think that's really important is, competencies in participation and accountability. I think that's very important. Engage, and again, it comes back to what I alluded to before, was engaging communities as well as other stakeholders in the decision-making processes and responsiveness to health systems. But we also need to look at, accountability structures as well in that regard. And another important fact is, competencies around privacy and confidentiality and trust in the healthcare system, and encourage, individuals to seek necessary care without the fear of stigmatization or discrimination of any form. I think those are some of the few that I would say are important. Another one would be, which Sean alluded to, was health policy and advocacy, is understanding the policies and seeing that are they aligned to what is happening on the ground, and some of those policies, regulations, strategies, and looking at to see that before we, in terms of addressing these policies, what are the gaps, what are the challenges, what is currently working? And these questions are essential because it's part of how we shape health systems, that prioritize equitable access and so forth. So I think those are very important. And another one to touch on would be population health management competencies. Promoting health and preventing disease at a population level requires a lot of competencies, and not just competencies in epidemiology, for example, but also health promotion, community engagement, that need to be in alignment with strategies around disease surveillance, health education, and preventative care. That's very important. And, I just want to shed light of one of the things that, Sean alluded to so many of them, and it was so wonderful to hear how he streamlined everything. I want to share something that recently occurred in line with what Sean was also saying. And this speaks to competencies that a study I've been involved in this year. And the information is already out there. We've released a report from the HSRs, and it also speaks to competencies. So this presentation, Sean, was very, very spot on. This was talking, and the information I'm sharing is, around a national skills audit that we conducted this year for the National Department of Health in terms of community health workers and our outreach team leaders, your OTLs. And, it speaks to what our chair has asked me and some of the, competencies that I alluded to just now. It speaks greatly to what is happening on the ground. And from this, we found that, in terms of the CHWs and the OTLs, while in an ideal situation where we want them, to be strengthened, there are some barriers, and I'm glad Sean mentioned that, we have to also look at what are the barriers, because from this skills audit that we conducted, in terms of the competencies, it was very clear that there is a hierarchical structure that often is missed in terms of the community health workers as well as the outreach leaders, in that most often the OTLs are registered nurses, while the CHWs, if you look at the competencies as well as the level of education, registered nurses would obviously, most often they would be registered nurses who have a 4-year degree, while your CHWs have a minimum of a grade 12, finishing a grade 12. And yet, despite this, we found that we expected them and their competencies to be strong, but what was very clear that came out of it was that the training was given at the very same level without taking into consideration of the fact that there needed to be targeted, specific training structures in place for them. Because once they were put into the same space, it was unfortunate that the OTLs felt that, most of them, as I said, not all of them are registered nurses, but majority of them were registered nurses. And so they felt that, being trained in the same sphere of, having that 4-year degree and having much more responsibilities as compared to CHWs, it was outlined and very clear. The other is that, when Chair asked me the question about competencies, often enough, we don't speak about, some of the competencies and how it relates to financial management as well. And that also came out very clear in the skills audit, in the sense that while the OTLs, were wanting more competency, to gain more competency in skills and skills around financial management, it was not a necessity for CHWs as such. And that was very interesting there. The other thing that comes across, and I'm alluding to this example, is because we spoke about models, and that's very important. And with the CHW and the OTL structure, we found that there is a cascade model that they follow nationally. However, sometimes on the ground, and this is where what Sean said was very important, that working with communities, because what they alluded to during the study, the qualitative component as well as the quantitative component of the study, was that, I've just lost my train of thought for a minute, sorry. So they were speaking about the cascade model, and different provinces function differently at the facility level. The needs are different, and we need to be cognizant of the needs. While you can have the training aligned to the national the cascade model, it is very important that within the training structure, in order for people to develop skills, to have these competencies, that we look at what is required at the facility level. Because we found that some of them said that they work mostly with health promotion and women and child health, while some of them allude to the fact that they are very much dealing with situations around HIV and TB. And you can see that, there's quite, they're not just nuances, they're quite distinct differences. So I think when we are talking about skills audits, when talking about competencies, we're talking about training, what I would say is that we need to be mindful of, as Sean suggested and said very well, was that we need to involve and make collaborative efforts with communities, find out what is required on the ground, what are the barriers there, what are the gaps there, what is working well there, and have those trainings set around that, so that we are, putting together, when we're talking about competencies, that people are competent in what they're actually, doing on a daily basis, and that we are not capacitating them for something that they are not experiencing on a daily capacity. So I'm going to stop there, and I think, give the others a chance for more reflections, Chair. But thank you very much for that.
No, thanks. Thanks for the mouthful. You touched on quite a lot. Maybe at this particular stage, let me call in Miss Mafoko. You can also touch on I know you touched a little bit around some of the potential barriers that could be in existence at some of the potential barriers. But please touch on the aspects to do with some of the challenges and barriers. Do you anticipate in implementing these comprehensive programs aimed at enhancing these right competencies within the health workforce? And potentially you can also talk about how can these challenges be overcome? What are some of the things that could be done to try and overcome some of these particular challenges? Mafoka, please go ahead. The floor is yours.
Thank you, Chair. And thank you to the previous speakers. Sean's presentation really touched on a lot of issues that are quite pertinent as far as competencies are concerned. I must say though, one competency that I'm not sure if it came through was the competency of advocacy as a core competency, especially for our emerging and already established workforce. So in terms of really offering advocacy and human rights based kind of teaching and training, I think is quite pertinent in today's workforce. Sean alluded to the health landscape, which is evolving. We are in the age of pandemics, and so advocacy is a really important competency. And I think more so for health professionals and clinicians and the collective, I think the commitment to doing no harm suggests that there is a need to focus on advocacy as well as upholding the rights of patients, especially where harm is being done. I think it's a competency that cuts across all competencies, and often you'll find that in institutions it's not incorporated within other courses. It's a standalone. It's either bioethics and the like. So I think it's definitely something that we need to focus on moving forward. But I think a potential barrier in kind of implementing this core competency would be an institutional culture where human rights and advocacy is being seen as political issues that are often confrontational and not necessarily necessary to professional practice. And so this can be a potential barrier. And I think the solution would then be to really incorporate human rights and advocacy education intrinsically within the curriculum. So this would then obviously suggest that health professionals need practical skills of how to then advocate for their patients as well as vulnerable communities, and really be able to critically analyze their context in order to offer care that is adequate for our evolving health system. Okay, I'll continue. But I think more importantly, another barrier is also what's referred to as dual loyalties, right? So the conflict between one's professional duties and one's professional duties to a patient and the obligation to one's employer and the state. So this is also another barrier that kind of can interfere with the implementation of rights competencies being really incorporated within today's health workforce. And so for me, I think my conviction is that it's one's constitutional, as a health professional, as a health worker, it's a constitutional right to speak up for patients. And so that would then kind of curb that conflict between having that split loyalty between one's profession and that of the employer. Chair, I'll leave it here for now, just so that I don't take too much time. I do still have a lot more to say. Thanks.
Okay, no, thanks. Thanks a lot. Thanks a lot. I just have got a couple of more questions, and I'm gonna try and throw them to some of the panelists. Prof Takalani, please unmute. I've got a question for you. I know some of these aspects have been touched on, particularly around the gaps. If you can touch more on that particular subject, where do you see the gaps, the current gaps in the healthcare training programs, particularly in nurturing rights competencies, and how can these gaps be also addressed? I know there's some interlinkages between what has been previously presented, but from your own perspective, where do you see those kinds of gaps? Thank you, Prof. Please go ahead and unmute. The floor is yours.
Thank you, Chairperson, and thank you so much, Sean, for such an insightful presentation, thought-provoking indeed. My reflections on your presentation would be, you mentioned that most public health professionals are not able to plan, collect, and interpret the data to inform their practices. And indeed, most South African MPH curricula, for example, makes these skills an elective module. Further on, you touched on monitoring and evaluation of what people are doing or health professionals are doing in programs to evaluate the effectiveness of those programs. And you indicated that this is often overlooked. I just want to concur with you and say most of the South African MPH curricula makes this also an elective module. You also touched on national initiatives, and you said they are not supported by the correct competent cadres. I want to concur with you by indicating that the notion of health promotion, for instance, when it came into place with the PHC re-engineering, there were no people or there were no health professionals who were trained on health promotion. And you find that district managers managing health promotion programs do lack this skill. In fact, Laetitia made me remember that even the nurse outreach leader is not health promotion trained to support the ward-based outreach teams. You also emphasized disaster preparedness for unforeseen pandemics that might happen. I just want to indicate that disaster preparedness is one of the presidential health compact mandates, which is not supported by the necessary skills in our country. You also mentioned artificial intelligence, which is needed to support public health programs. And I feel that is true because many professionals are scared of making use of artificial intelligence, thinking that that will replace their jobs, as you mentioned. I also noted that there is a skill that we usually often overlook, health communication. This is where we design fascinating messages to persuade individuals to adopt healthy behaviors. And I think this is not emphasized in any curricula or in any training program. So I happen to be one of the what do you call them? Co-investigators, co-investigators in a study, in a 2020-2021 MPH competencies utilization study, which was conducted in South Africa by 8 universities under the leadership of UCT. This study identified that many MPH graduates from South African universities are not confident in their health policy development skills, leadership skills, communication skills, systems thinking skills, biostatistics, and epidemiology skills. So I want to concur with you that there is still a need for us to really look at what are the competencies that would be able to support our health programs. I also noted, and with consent this time, that there is a difference in curricula between public health medicine and public health master's curricula. You know, one who's in public health masters does not know what is done in public health medicine. One who's in public health medicine does not know what is being done in public health master's degrees. So I think there is a need to synergize the two. Coming to your specific question, Chairperson, where you say, where do I see the current gaps in healthcare training programs in nurturing the right competencies, and how can these gaps be addressed? I wish to start by indicating that our country, with its PHC reengineering, is busy reorienting health services to focus less on hospice-centric curative services and more on health promotion in the era of NHI, where people are to be empowered to take ownership of their physical, their mental, and their social well-being. And the key category of health workforce here is the ward-based outreach team that is comprised of 6 to 10 generalist community health workers per team, with the support of the nurse outreach team leader, as Laetitia has alluded, and the data capturer. Their scope includes conducting community, household, and individual level assessments, identifying potential and actual health risk, and assist the household or individual to seek appropriate care, and so on and so on. If indeed these ward-based outreach teams are to be the face of the South African healthcare system as the first point of contact, the right competencies around this scope of practice need to be fostered. What do I mean by this? I think there is a need for an intensive community health worker training program to foster the right competencies, which include, as Mafuka has alluded, ethics around working with human beings. At the moment, the community health workers use government-designed data collection tool to conduct a community, household, and individual level health assessment. I'm not sure what happens to the collected data. I just think that data captures this data onto the DHIS, the District Health Information System. And my question is, who analyzes this data to identify the health risks or determinants of health among individuals, household, and communities, and use the findings to plan health promotion interventions? According to the ward-based primary healthcare outreach team policy framework 2017, it is this ward-based outreach team's scope of practice to identify the potential and actual health risks and assist the households to seek appropriate care. And if you look at this scope, or the mindset behind this scope to identify potential and actual health risks and assist the household or individual to seek appropriate care, you will see that it is still curative. It is like saying, go out there and look for individuals who require care or curative services and refer them. Thus, our community health workers in the main exist to link individuals, households, and communities to care or curative services. There seems to be no intentionality to empower individuals, households, and communities to be responsible for their health and well-being by adopting healthy behaviors. Communities, in this case, I feel they are left behind in this process. And my take is that there is a need for a training program to shift mindset from care services to health promotion throughout the healthcare system, from policymakers to community health workers. And in addition, the ward-based outreach team scope seems to be focusing more on physical health and less on social and mental well-being of individuals, households, and communities. So skills program to train community health workers to foster recreation and leisure among individuals, households, and communities is needed to promote both social and their mental well-being. And I think in addition, we also need skills program to train community health workers to enable them to assess mental illness risks, as we have had the day before yesterday when Prof. Ramnik was talking about promotion of mental well-being through health education. In addition, I think skills program to train community health workers to assess BMI in order to diagnose overweight and obesity is needed as a baseline for nutrition-based educational interventions, including physical activity. Thus, we really need to reorientate the community health workers training to make our prevention or preventive and promotive efforts like a brick wall with electric fence protecting people from physical and mental illnesses to reduce the burden from our curative facilities in the era of NHI. And my take is that there is a training program missing in the health system training puzzle, namely the health promotion at undergraduate level. I heard Laetitia emphasize this. She just didn't put it this way. But there is an undergraduate degree in health promotion that is needed to produce health promotion cadres that are in possession of the right competencies to assess individuals, households, and communities, and use the findings to make community diagnosis, household diagnosis, individual diagnosis that highlights the health problems and the associated political, environmental, social, cultural, biological, etc., risk factors or determinants. In other words, our focus should be on population health. And that after we have diagnosed them, we should be able to respond to such diagnosis with planning health promotion or empowerment interventions. And I'm gonna look at the empowerment that I'm talking about in terms of only three strategies, health promotion strategies. One has already been emphasized by Mafoko, which is advocacy, but I will start with mediation. Mediation is always needed because when we have identified a community problem or community's problems or determinants or risks in the community, sometimes there is a need for mediation to take place between the communities and the municipality-based providers of services for the creation of supportive environments for these communities to be able to adopt healthy behaviors. Another health promotion strategy that I think needs to be put in place as a way of empowering our communities is enablement. This is where we are capacitating the communities, their personal skills in order for them to be able to adopt healthy behaviors. I won't repeat advocacy as it has been alluded to by Mafuko, but it is there to strengthen community action to address all identified determinants of health. So this kind of a planning, if it can be there, it can only be done by someone with an advanced insight into public health, such as a well-trained health promotion practitioner. Some tertiary institutions are already offering such a program or qualification. And I think PHASA can here take a center stage in rationalizing its curricula to ensure that South Africa has the right competencies to reorient the services from more curative perspective to health promotion mindset in the era of national health insurance. I will leave it here, Che. Thank you.
Thanks a lot, Prof. Thanks a lot, Prof. For clearly articulating these aspects around some of the current gaps in the healthcare space and potentially how we could potentially address those particular gaps. May I call upon Dr. Nyembezi, just from your experience, now talking about your experience in this space, what innovative approaches or strategies have shown promise in cultivating these essential skills within the future of workforce. You can touch on a little bit around your experience or what you've seen out there in this particular space. Dr. Nyembezi, please go ahead and unmute, and the floor is yours. And also please reflect on the presentation, on the keynote presentation. You can touch a bit around that before jumping into responding to the question that I've just posed. Thank you a lot. Dr. Nyembezi, the floor is yours. You can unmute. Thank you.
Thank you. Can you hear me, Chair?
100%. You're so loud
Thanks.
and clear.
Thank you very much. Thanks. I must say that I was also impressed with the presentation by Sean, and the previous speakers also have alluded to some of the issues that I wanted to reflect on. But I will just be brief in terms of the 3 components that I want to reflect and link them with the previous speakers. The first one is about the academic collaboration that he spoke about. And that's what the Prof now, in her final submission, that's what she spoke about, the importance of health promotion as an undergraduate. I think we, as a health promotion special interest group for PHASA, we are making a commitment this year that what we will do, we will conduct a research looking at health promotion across the universities of South Africa. So I'm sure that we will announce to the board soon in terms of how we want to take that, and I will invite Prof also to be part of that because we see that there's a need for a dialogue within the university lecturers in terms of trying to understand what are the teaching methodologies and discuss some of the competencies that we are discussing today in terms of what kind of competencies that we want for our health professionals. And of course, University of Witwatersrand University is one of those universities that we are targeting. We're trying to recruit as much people from that university to be part of the special interest group. And of course, when we do this, it is really about making sure that we are working together as academics and the professional, as alluded by others. And then another issue that I want to reflect on is about the continued professional development. This is very important. And again, we, as I've seen in many universities, that they are providing these CBD programs as a way of capacitating the healthcare professionals. And one of them that has been mentioned, the evidence synthesis, which is very important. We want our healthcare professionals to understand and engage with evidence in terms of how they provide their services. So it's very important and key. And I will allude it into one of the examples that I want to make later on. But I think I'm agreeing with that, and we also do it, and we do it also as part of the interprofessional education, which is very important that we do across disciplines. And then lastly, there is an issue of ethical values that we spoke about, and I want to link that with what I've seen, that recently now, what we are teaching, what the kind of competencies that we all want healthcare professionals to have is to look into health as a human rights principle. And that one of the ethical values that we also want to make sure that we emphasize in our as a competency. We should make sure that they understand that they have to respect diversity, they have to be inclusive in their own approaches in terms of sexual orientation, age, religion, disability, and cultural beliefs as well. So we want that aspect also to be emphasized in terms of the competencies, as they will be able to address issues of inequity, social justice, and prioritizing the need of the marginalized. So we want that ethical value also to be amplified as one of the competence skills. And what I've also observed is that what we are now what we're seeing now, we're seeing that we are moving away from the medical approach as the only approach in terms of our intervention. So our professionals are gravitating towards other approaches like behavioral approach, educational approach, empowerment approach, which we have spoken a lot during this week, and then the social change approach. So some of those aspects are very important, are key in terms of how our health professionals are dealing with these issues. And I just want to make one example, because this is what I wanted to say. I linked to the CPT programs. There are lots of universities in South Africa that are providing what we call motivational interviewing. And that's very important as one of the component or the competencies of the healthcare professionals. So what it does, because remember, as health professionals, and for some of us who are health promoters, we want to enable people to gain control over their lives. So what motivational interviewing does, it's designed to help people to make behavioral change. And then it's more persuasive than coercive, it's more supportive than argumentative. And overall, it's about increasing the client's motivation so that they can change, and the change comes from within rather than as imposed. So we see this as a very important course. It's a very short course. Other universities, they do it within 6 months, and we would like to encourage more healthcare professionals to do it. And again, it's learnable by practitioners of diverse health professionals. And then, so it has been proven, its efficacy has been proven. There's a lot of literature that has been written to show the efficacy in variety of problems, including substance abuse, risky behaviors, and also increasing healthy behaviors like medication adherence, issues of diet, issues of exercise. So we want to encourage and hope that some of the innovations that are in place. And also it's really important to see that as part of that, it helps the professionals to be able to provide the opportunity for their clients, and then provide capacity as well, make sure that they are capable of changing. So also, as we spoke lengthily this week about issues of we don't only need self-empowerment, but we also need community empowerment. And I think this is one of the things that it's again showing its importance in terms of how we deal with these issues, because really it's about trying to make sure that we develop our communities, and then we make sure that they participate in order to be able to change the world. And so that it's very important that we capacitate them. And because we know that we must understand that some of our community members are powerless, even though they feel strong about what they want to change. But then if we empower them, we will be able to do that. And one aspect that I want to link with other speakers that they've mentioned is the issue of health advocacy. So it's very important when we do with issues of empowerment and capacitating our communities and patients. The issue of advocacy is very important, and it should be strengthened. And then one last thing, Chair, that I want to talk about. The colleagues will also acknowledge that if we're speaking about evidence-based programs, we also offer some models, but there's a model that we see that it's gaining momentum in terms of our teaching, which is precede, proceed model, because it's got 9 phases where it really speaks about issues that healthcare professionals need to really think about it. It talks about that there's a need for us to do the social assessment, epidemiological assessment, behavioral and environmental assessment, educational and ecological assessment, and policy assessment. So basically, as a social assessment, we should be focusing on what the community wants. What does it need? We should be able to provide solutions, but the solutions should be based on what the population want. So we are encouraging our healthcare professionals that part of that competence, they should be able to determine what citizens want in the community by having surveys, focus groups. They can be a lot of methodologies that they can use in terms of identifying what the community want. And then we talk about the health issues that they do need to look at. But what more importantly is that we need to understand that some of the communities, as we understand and try to identify these issues, there are modifying factors that they have to look at them, predisposing factors, enabling factors, and reinforcing factors. So it's very important when they do this assessment to also look at that comprehensively. And again, the issue of advocacy for the policies that will be making their lives better. And then lastly, colleagues, I just want to say that we really want to say, as part of the universities, we will look into these issues, but more and about, we appreciate that some universities, they do have electives that are very relevant to the competencies that we talk about. Like, as much as they offer some core modules, but they have electives for the healthcare professionals so that they can be able to be dealing with issues that are relevant to them, like monitoring and evaluation, and we're looking at issues of health and globalization, and we have some modules that are looking at pharmaceutical health, public health. So some of those electives are designed specifically to deal with issues that are relevant to the particular health professionals. So we need to encourage diversity of these electives and encourage healthcare professionals to look around in different universities to take them, and also hope that the government will play the part and provide them with the resources to do those kind of like CPD programs. Chair, I want to end there. I don't want to take long. I think I will end there for now.
Thanks a lot, Dr. Nyembezi. I think you were quite clear, and I really appreciate you sharing information around motivational interviewing, which is more inclined towards has got more intrinsic elements to how we engage with the clientele. At this particular juncture, I would want to shift to one of my panelists. Now we are going the direction of technology and digital innovation. And I know this is the area, this is the forte, this is the area of expertise. Though she's in the health space, but she's done lots of work in the digital and technology space. Renee Sparks, please kindly unmute. My question to you is around how can technology and digital innovation be leveraged to enhance the acquisition and potentially the assessment of the right competencies among health professionals. So when you look at these health professionals, how can we tap into technology, innovation, digital innovation in order for us to do so? Renee, please go ahead and unmute, and the floor is yours. And also please reflect what are your thoughts on the keynote address. Thanks a lot. Renee, over to you.
Thank you so much, Chair, and thank you very much, Sean, for your presentation and everyone that's given their input. It's been a really, really great conversation. I was left with a few things that I thought really struck me, was speaking about context. So even if you think about technology and digital tools, the context is important. But then also you mentioned about the quantity of healthcare professionals versus the quality of what they've learned and how they kind of implement that. And I can't agree with you more. That is, for me, that is one of the biggest things. I work on an HIV testing program, and we've used digital tools and technology to kind of share e-learning. We use the e-learning platform. We use assessment tools and things that are all digital and kind of help us think through whether or not our counselors are competent, but we can't really do that without looking at the fact that what does the environment look like? Who have we omitted when we've done our planning and when we've actually looked at the data? And we learned our lesson the hard way, where we realized we focused on healthcare work or community healthcare workers or HTS counselors, and we didn't take the nurses along with us on the journey. So you had this group of people who you've created as an expert, now having, in the sense of the South African health system, the hierarchy, this person that's overseeing doesn't know what the counselor knows. And so you had those issues that we kind of had to piece together. So again, emerging, for me, what stood out from what you spoke about was those emerging healthcare practitioners versus the ones that exist that we keep forgetting about. I mean, my background is in nursing, so I know it's like see one, do one, there you go. There's not someone coming back and saying, okay, let me coach you through this, let me mentor you through this. What is the program looking like? And for me, that's one of the biggest gaps we have. And I'm trying to change that even in the program that I manage, but it's difficult because you're looking at the ecosystem that you're sending these people back into that isn't really equipped to capacitate and support that type of nurturing. Very often things are looked at in a punitive lens. So if you've gotten something wrong, then that's going to be against you. Then what stood out from the other speakers was around health promotion. And especially looking at social behavioral change communication, our use of the media, our use of social media as healthcare practitioners. I mean, you look at TikTok, for example, and you'll see there's quite a lot of healthcare practitioners that are doing things, but then you have other ethical issues, you have issues around the accuracy of communication, and of course, other areas of their own lives seeping into it. So how does that look in terms of uplifting different professional spaces? The use of applications and then messaging. How do we standardize that, or how do we ensure that that looks in a certain way? I used, over the weekend, I used an AI app to come up with a health promotion message for TB. And I stood there like, it gave me nice ideas, but it took information, because remember, we putting the information into these systems, and what it came up with was very stereotype images. So when we look at technology and we look at having healthcare practitioners use that, they also need to critically think about what it is that they're generating, right? So yes, the message might be clear that TB can be cured, but what is it that we are showcasing? We're showcasing that Black and brown people are the people with TB, and the doctor is on the other end of this. So we are actually just perpetuating those stereotypes and essentially the health inequity. So for me, the other issue was around collaboration. When we have digital tools and we have technology, it can't be only left to the expert. Who is the expert? How do we bring in other voices? How do we make sure that the end user is part of this process, that we have different voices? It's not just the same people, like-minded people speaking about what must be in this assessment or in this tool. And I can absolutely agree that competency is critical. I think it's one of the lessons I've learned on my program now is that we've assumed that nurses would know. And that was an incorrect assumption. So now coming back and having to create competency tools that speak to both the HTS coordinator and the nurse, and now having to change language, because we know that for me to say I'm going to measure you in the same way as the HIV tester, it's a problem. Right, so lessons learned, kind of go back, reflect. For me, that's been a very, very important process. And I think something that's lacking when we are training healthcare practitioners around reflective practice and actually sharing that. And again, around context, so that matters. The theory to practice to real world situation, that's also something that we need to look at. Very often we would expect people to give references, and it's beautifully, it's done well, but there's no critical thinking and there's no application and there's no argument. So if you're telling me follow Mintzberg on this, but this is a South African context, and I can tell you it's not working, I've managed how many clinics before, then my argument should be clear as to why. So I think we need to look at an African context as well, an African voice within all of these, the curriculum and everything else, because we seem to be focusing on a very westernized model. And again, just the building in of coaching, mentoring, and supervision within our technology. And this is what technology gives us the opportunity to do. So currently on the program I manage, we're building different apps, and we're trying to see whether or not these things are actually happening. So not just from a tick box exercise, so looking at what verifications we've put in, questions we've put in to see whether or not this thing is actually happening. We know that South Africa uses a peer-led assessment model. So I think digital tools and technology give us the opportunity to actually check whether that is true. And then looking at competency through a rights-based lens as well, and inclusive lens is critical. I've looked at a few of our assessments and tried to see how does that then speak to data-driven. If I'm saying this is the program that I'm rendering, how do I make sure that it's shaped for the province or the district or the sub-district? So not just having a cookie cutter approach is critical. So yeah, I think technology in the digital age is here. It's not going anywhere, and we might find resistance in some places, and in other places it's the inequity, right? So access is an issue. And I think that's where the collaboration comes in with your activists, getting people to understand what advocacy is about, getting them to understand how to collaborate and to partner with those who can do what you maybe cannot, because you're in a health, you're working for government, so you cannot be speaking about certain things on certain platforms, but it's about collaboration and partnership, and then about the evidence that suggests that more needs to be done and where you pitch that. So yeah, I'm going to stop there. Thanks.
Thanks a lot, Renee. Thanks a lot for that. Colleagues, you've heard a bit from the panelists. I've been bombarding them with a couple of questions here and there. The floor is open. Please kindly raise your hand if you've got one or two comments and thoughts and questions, or something that you would want to pose. Krishna, your hand is up. Please kindly unmute. Colleagues, also use the chat box.
Thanks very much, Chair. Again, I just want to echo the sentiments. It's an excellent session and really well done to all the speakers. Mine are more comments. So I think, if one is looking at the health system, you almost looking at a spectrum from individual patient care right across to communities and population health and everything in between, right? And the competencies that we need to build are for that entire spectrum from the individual right up to population health, right? But I think one or two of the speakers did allude to the fact that our system is very curative based. So it is very individual based. And so we in the public health fraternity need to work hard about pulling the system up towards a lens of community and population health. And we need to even work with our clinical colleagues, right, to actually have a population mindset and to think broader as well. Then in the health system itself, we have got people that do clinical work, but then also people that do support services type work, management, leadership, etc. And competencies relate to all of those cadres of health workers. So I just wanted to make that first point. Then the second point is that if one is thinking about skills, you got these hard skills, which are the kind of technical skills, but the soft skills are very, very important. And I think everybody in the health system, irrespective of where you're based, we are dealing with people all the time. So soft skills become very, very important, and included in this are the interpersonal skills, the values, the communication skills, the ability to have difficult conversations, conflict management, etc. So I think I just wanted to surface the issue of soft skills. My last comment is, I think there's been a bias towards focusing on training programs. And I think many of us who work in the academic sphere tend to kind of see that as an important area, and rightly so. But every day, every minute, every conversation is an opportunity to learn, right? And I think we don't place enough emphasis on the learning environment in the workplace, and using every opportunity to learn and to strengthen our skills, to reflect, etc. And that requires people in the health system to first of all pay attention to that, and the leaders to try and create a learning environment. And of course, our academic partners can enable and support that process. So the point I'm making is, it's not only about sending people out to training courses, but actually in the workplace every day in practice, there's an opportunity to learn. And in fact, from a sustainability point of view, from an impact point of view, that's the area we should focus a lot on. Sorry for the big mouthful, but thanks very much, colleague, Chair.
Perfect, and thanks for the addition and the value addition actually. From an angle of chatting about the soft skills and highlighting the value that comes with the development of soft skills. I see your hand is up. Hash, your hand is up. Please unmute. Please unmute. I can see some comments are in the chat box. I would advise Dr. Sean, just jump into the chat box. You'll be the next one. I'm going to be posing a question that is in the chat box for you. So get yourself prepared while Ash is unmuting. Colleagues, feel free to throw some comments in the chat box before they disappear from your head so that you can keep them there safe. Ash, please unmute. You can put your hand down now.
Great. Thanks, Ndumiso. And yeah, thanks everyone for an excellent session. I think, Sean, you really started off with an excellent overview of public health curriculum and with the WHO roadmap, which really has such a comprehensive and vast approach. And all the other speakers as well touched on such important concepts. I think there really is a lot to take away from today. And then, yeah, Prof. Vallabhji, when you were speaking, I was considering lowering my hand because a lot of the thoughts I were having were similar to what you were saying about really considering the spectrum of the health system and health professionals, starting from the home all the way to the public health level. And I think that's also reflected in the roadmap that Sean described. But obviously, currently, now we are focusing on the academic sphere, but it is important to be holistic. And I think the reflection for me of all of this was similar to in some of the other sessions this week, the importance of health in all policies and how we as a public health fraternity do emphasize this. And a lot of health is about training in the different competencies required. And then the other thing I wanted to also talk about was the soft skills. I was involved with the College of Public Health Medicine Curriculum and Assessment Practice Committee. And we did a curriculum mapping of our old curriculum last year to kind of inform practices for the new curriculum. And in addition to your very technical competencies related to behavioral and social sciences, health services management, health economics, health informatics and measurement, disease control at a population level, the one gap we found, and is probably an area that's going to be added, is critical cross-field and personal outcomes, which really talks about some of the softer skills that Professor Vallabhji mentioned. And I'll just mention a few that we had considered for inclusion of our curriculum. And we based it on the HPCSA framework for competencies for an undergraduate. And it was really looking at, as a public health person, be a good communicator. And so for that, they really need to understand, have communication skills and also media skills, because they need to communicate with the outside world. They also need to be a collaborator, so they need to work within teams. They need to be a competent healthcare professional. And I think a lot of people previously also alluded to the ethical practice and professional practice that needs to be included in the curriculum. And I think, yeah, people also need to be health advocates as well. There's a lot of those elements that should be included at different levels for the different curricula. So yeah, thank you, and thanks Ndumiso and to all your team today for a great session.
Oh, thanks a lot. Thanks a lot for that value addition. So please go ahead and unmute. Please go ahead and unmute. The floor is yours. Please go ahead and unmute. You're noted. Thank you.
Yes, thank you, Chairperson. Firstly, we want to express our gratitude to Dr. Sean for the excellent presentation, and also to all panelists, Professor Takalani and Dr. Nyembezi and the others for their input. I don't have a question as such, but what I wanted to ask is, when Dr. Nyembezi is talking about motivation interviewing, he talked about the course of 6 months. I wanted to, if Dr. Nyembezi can tell us the requirement, how to go about it. That is my question. Thank you.
Okay, thanks. Dr. Nyembezi, go ahead.
Yes. Thank you very much. No, it as I've said that this course, it's for everyone. Even community healthcare workers can do it. But also, when I was talking about 6 months, basically what they do, they give a workshop or inputs in terms of the sections where they in that input, you'll find that they do about 16 hours or so. And then there is a follow-up where you will participate and be mentored in terms of how to do basically this intervention. And then what they do, it varies from one university to another. I know Stellenbosch is doing it. I know UCT, University of Cape Town, is doing it. So it varies from one university to the other. And in terms of the number of people that they want to participate, also it varies. But it's very interactive, because the expectation is that you should be able to motivate your client to change the behavior. So they take you through workshops and phases and some role plays as a group, as a cohort that is attending it, and eventually you would be then allowed to start working with patients. But we don't offer it at the University of Western Cape. Other universities, they offer it, and I will encourage you to look at their websites, and I can share a few that I've seen. And at the University of Western Cape, we used it as a research tool. So we took our community healthcare workers, we trained them for the duration of the 6 months that I'm talking about, and they were able to do it among themselves, like to pick one thing that they want to change. And then we saw that when monitored that they can do that, and then we then allow them to start interacting with the clients, because it was a research. So we use them as a way of piloting it among themselves to say how they can do it. So as I'm saying, even community healthcare workers can use it and motivate their clients how to breastfeed, or even how to adhere to ART, those kind of things.
Perfect.
Thank you.
Thanks for that. Professor Francis, please come through. Dr. Sean, just be ready, be warming up. Professor Francis, please come through and unmute. The floor is yours.
Thank you, facilitator. Thank you, chair. Thank you, all the presenters and the commentators. I've been really highly impressed by the comment from Dr. Nyembezi when he was talking about the health promoters, because actually Walter Sisulu University produced a lot of health undergraduate health promoters which are actually on the market but are not employed up to now yet. So I think it is a high time that we also think of them, because it's a group of people who will be able to actually motivate and encourage the communities in terms of health education and health matters, which we are dealing with. We have a group of them actually who are unemployed, and the course is still continuing. And we are even having some of them who are actually at a postgraduate level rather than the BSc health promotion. So I think this is a very good movement forward or motivation in terms of what we are dealing to, especially to the communities that we are dealing with. Thank you.
Thanks a lot. Thanks a lot for that input, Prof. Dr. Sean, please go ahead and tackle the question that is in the chat box. I think that one it's even directed at you. Please, at the end of responding to that question, because of time, may you please give also your closing remarks for this particular session, and thanks a lot. Over to you, Sean. Tackle that question in the chat box. You can unmute.
Thank you very much, Jay. So the question was around, we often say we want to have these transformative learning opportunities, but do we really create them? So the example that I have from University of Pretoria, so I actually coordinate a module next week, and the module next week is around One Health. And because One Health is the concept of One Health is about the environment, animals, and humans. We needed to think a different way of doing it. So that module in particular has fifth year, these are your students that study at the Faculty of Vet Sciences, so your vets, and then they're also third year medical students. So we're combining these two faculties, these two students studying the different degree programs coming together. And when we talked about disaster risk management, that's one of the activities we will have. So if there is a pandemic, for example, how do you tackle these issues around One Health? Because I'm not a One Health expert. I'm an expert in environmental health, but I can contribute to the One Health conversation. I have a medical doctor that may not be trained in certain environmental issues, veterinary issues, but they make a contribution. Same for the veterinary students. So it's one of those modules, and this is the third year that we are presenting it, that trying to have different perspectives on the issue, but to role play that in a disaster risk management scenario where you need these collaborators on board. If there is a flooding, for example, who do I call if I have in a community, I have people, there are animals, there's environment, and it's really trying to do that. And as part of the training in next week, trying to put these groups into different rooms and discussing if these are the policies we have around the issues, what is their reflection and their perspective on how we need to address all of these. I think that's one example. There are a couple of more. So I think it's really for universities to start to put these types of courses or these types of workshops together, but not only for the students, for the academics as well. We throw around words like interdisciplinary, transdisciplinary, but very few universities actually have sessions on what does this mean, how do we incorporate this, how do you get involved, and how do you have a voice in this multidisciplinary space. So I think that's, I hope that addresses the question. I think in reflection for me for the presentation and in closing, I do think that we have to give ourselves recognition. A lot of progress has been made in certain things. It's not to say that nothing has been done. I just think we're now in a great opportunity to be able to learn from the lessons. But if we're moving forward, we really need to take into consideration that times are changing rapidly, and we need to adapt. both in the teaching aspect as well as learning. And I'm glad that the questions were around learning is not just an academic environment. It is out there on the social media posts in the work environment. So really to foster this environment of continuous learning and learning from one another, that's where the diverse expertise come in, and that's where you have true transdisciplinary research and expertise in order to address these competencies in this changing world. And then you can capacitate a next generation workforce that is resistant to any issues, any threats that were to happen, and they become resilient. Thank you very much.
Thanks a lot for wrapping it up nicely. Colleagues, at this juncture, I would like to thank my panelists, and also I would like to thank my keynote speaker for the wealth of information, and of course, not leaving out everyone who came through and attended today's session and who has been there for this past week. You have been engaging, you have been so insightful. There's been a lot of ideas that have been bounced off, and you have come in with lots of energy and enthusiasm, and you have brought in from all the different angles. I would like to say that let this discussion continue. Colleagues, in our midst, we are also fortunate enough to have Dr. Lwando Maki, who is the current president of the Public Health Association of South Africa. And I would like to take this opportunity to request him to actually unmute and give us our closing remarks. But at this particular stage, I'm actually signing off and handing it over to the president to come through and give us his closing remarks, his words. Dr. Lwando, please come through. The floor is yours now. Please unmute.
Hi, Jimmy. Can you hear me?
Sure. Loud and clear.
Lovely. Sorry, everyone, I'm on the clinical platform. I'd like to thank everyone for attending this week and helping us as PHASA to build Carthage, as I've been saying throughout the week, where we're trying to repeat the gateness within Africa through improving the health of our people. And all the speakers have contributed to that, and all the attendees have also helped with that. And I really appreciate it. So I do want to invite people to join PHASA and help with the going forward work, where we're doing activities within our special interest groups, and also with our conference coming up in November this year. As you know, it's been quite a success, with the last one being the greatest, most attended, and we hope to build on with that. And we're building up towards the World Congress, which will be happening in 2026. And also, I'd like to make sure that people understand that we will be active within the different conversations that are happening within our public health platforms, and also trying to hold the government accountable so that we can improve our people's health. And that is a very important part of it. And last and not least is that we also have a strong environmental SIG. We also have a strong environmental special interest group, Climate Energy SIG, with Mafoko leading it, that you should join if you also want to contribute towards climate change, and special interest groups, which will be sending out an email to allow members to join. So please join us, and thank you so much to Ndumiso for sharing today, also Sean and the rest of the panelists. We really appreciate that. And on behalf of the PHASA board, we'd like to thank everyone who's here this week. Thank you so much. Over to you, Ndumiso, to close.
Okay, thanks a lot, colleagues. My job is just to close this session. And thanks a lot to everyone for coming through to this session. Enjoy the rest of your day. You can now go for tea break. 3 sugars, please. Thank you. And bye.
Thank you, everyone. Thank you. Take care. Bye.
Bye.
Bye.